Thankfully, it's a pretty seamless process. The day of surgery, whether it's ICL surgery, refractive lens exchange, or cataract surgery, we perform these surgeries at a standalone surgery center in Beverly Hills. What's really nice about this surgery center is the only thing that gets done there is eye surgery. And so every single day of the week, cataract surgery, refractive lens exchange, ICLs are being done. So the entire staff, from the front desk all the way to when we get to the operating room, everyone is extremely well trained and very skilled at what they do. Some people have been there at the surgery center for 10, 20, 25 years. And so everyone has a very broad range of experience. And that's nice because for patients, it means when you come in, you're not necessarily seeing someone who just happens to be rotating through, and then the next week they're going to be, doing cardiac surgery or something like that. You get a whole team dedicated specifically to the eyes. When it comes to what else to expect, we typically have our patients arrive at the surgery center about an hour in advance of surgery. They get to meet the anesthesia team, the nursing team. They get their eyes dilated. Any paperwork that needs to be done gets finalized. And then typically for most patients, we have an IV that goes in the arm. Some people prefer to have surgery without an IV, and that's totally fine depending on their medical history. But for most patients, they like having an IV in, and then the anesthesia team, which will be present in the room at all times, they can really control or titrate the dose of the anesthesia that the patient gets. So if a patient knows, hey, I haven't done well with X, Y, or Z anesthesia in the past, they can have that discussion with the anesthesia team before we even start surgery so that the anesthesia can sort of be custom tailored to them and their preference. Surgery itself typically takes about 10 to 12 minutes per eye. Refractive lens exchange and EVO ICL surgery, we tend to do both eyes on the same day. Cataract surgery, we tend to space out by about 1 to 2 weeks, or sometimes we can even do both eyes within the same week as well. We typically like to see how one eye is healing for cataract